Hi, good afternoon, everyone. Glad to be back up here to provide a brief update on our vaccination campaign. So as the governor shared, this was a big week for us. Now with the expansion of eligibility to those 16 to 39 years of age, all adults are now eligible for the vaccine. And we've been off to a great start so far, already on track to vaccinate more Rhode Islanders this week than we did last week. Between Monday and this morning, we've made more than 15,000 appointments, and about 75% of those have gone to Rhode Islanders 16 to 39. As I've shared in the past, we've done a lot to build out our vaccination capacity throughout the state to be ready for this phase. We now have 5 state-run sites, 3 regional municipal sites, and dozens of pharmacy partners and local health clinics. So all that being told, we're sitting roughly at about 150 unique vaccination locations throughout Rhode Island. So what that means is that about 97% of Rhode Islanders live within 10 miles of a vaccination clinic. And as the governor shared last week, we've partnered with RIPTA to make sure that no person has to pay for public transportation to these sites. We're continuing to work to make vaccine as accessible as possible to all Rhode Islanders. One example is that we've started to pilot walk-up appointments to vaccination clinics. Generally speaking, registering in advance is always best. That way you know you'll definitely have a slot. But especially with availability this week, you can even register for clinics on the same day. So for this week, we're going to pilot walk-up vaccinations on Friday and Saturday at the Dunkin' Donuts Center and at Sockanosset Crossroads. The Dunk will be open from 9 a.m. to 6 p.m., and Sockanosset will be open from 7 a.m. to 9 p.m. So this is a bit of a different model for us that's slightly more complex. So we're going to pilot it this weekend, and we'll learn and continue to adjust moving forward. With all of this happening, though, we're always continuing to plan for the future. A lot of you have probably read or heard the comments from both the Pfizer and Moderna CEOs over the last few weeks about a booster dose. While we don't have anything official on this yet, we're thinking about how to integrate our COVID-19 vaccinations into the more traditional practices of medicine. There may always be a place for COVID-specific vaccination clinics, but we envision vaccine being more accessible in places where you traditionally access health care in the same way that flu shots are today. So all this is good. We're in a great place with our vaccination campaign, and we're confident in the course towards reopening that the governor outlined. But as Dr. Alexander Scott said, reopening and vaccination are directly connected. Our successful reopening depends upon people getting vaccinated. Another important consideration for everyone is that it's not just about protecting yourself, but protecting those that cannot be vaccinated. I got my first shot this week on Tuesday at Sockanosset because I want to stay healthy and safe. But even more important, because I have 2 young children that are too young to be vaccinated right now. So do your part, get your shot, help others get their shots, protect yourself, your loved ones, and all Rhode Islanders.